off. It was plenty going on as always, but we appreciate you all joining us for the call today. We've got an exciting program coming up, but there are a few introductory things we wanted to remind you of and introduce and make sure you saw in advance. Let's go ahead and hop into the slide deck, Deanna. So first, always want to remind you that the educational conference is coming up June 9th through the 12th, 2024 in Grand Rapids. I have seen the beginning drafts of the retail track. It's going to be awesome. I can tell you that right now, but it is shaping up very nicely. One additional thing that is new, something that I've been hearing for the last number of years, but we were never able to fit it into the conference, was the desire for to have an opportunity for the program managers to come together in a closed session and program leaders and have a discussion about topics that were important to them. More of an opportunity to truly collaborate on your programs and talk through some of the challenges you're facing. So we will have that opportunity on Sunday morning, June 9th. We'll have a 4-hour session available for program leaders, and there'll be both a retail and a manufactured food section of that. We will be sending you an official invitation in early January to participate, and along with that, we'll also be asking for, are there topics you'd be interested on that agenda? We're going to really craft that agenda based on your feedback on the areas where you're having, where you'd like to talk about with your colleagues about what they're doing and those sort of areas. So really an opportunity to share and discuss and hopefully learn from each other in a smaller setting in that world. So something new. Hopefully, many of you will be interested. It's something that I've been hearing behind the scenes, particularly as new folks come on board. There's been a strong desire to have that sort of meeting occur, but I just haven't been able to fit in the calendar. We were able to this year, so you'll be seeing the invite in early January. Let's move on to the next slide. Just wanted to remind you all that we are nearing the end of registration for the Food Safety Culture for Regulators with Frank Yanis, which will be January 3rd and 4th in Kansas City. Note that if you are an AFTO member, there is a substantial discount. So we would encourage you to think about participating in that. And actually with that, I think I'm just going to, this talks a little bit about it. Deanna, is the video next? Let's hear from Frank a little bit about what that's going to be before we move on.
Well, hi, my name is Frank Yanis, former Deputy Commissioner for the Office of Food Policy and Response at the US FDA. And I just wanted to take a moment to encourage you to attend a workshop that AFTO is hosting in early January in Kansas City. The topic of that workshop is food safety culture. Now, you might be asking yourself, why should I attend? Well, in the 35 plus years that I've been working to advance food safety, both in the public and private sector, I can't think of a more important topic. Of course, we need all kinds of tools in our toolbox to win the battle against foodborne disease, whether it's tools of testing, training, and inspections. But we also know that if we're going to make significant improvements in reducing the burden of foodborne illness, we have to get better at influencing human behavior. That's right, human behavior. So this workshop, 2 days in total, will be focused on proven behavioral science strategies on how to create a food safety culture and get higher rates of compliance by influencing organizations and people. So please mark the dates on your calendar. Look forward to seeing you there. And thank you so much for what you continue to do every day to advance food safety so that people can live better lives, not only in our country, but in countries around the world.
And just to put in one more plug here, I just want to tell you all, this is very similar to a workshop that Frank does every year at Michigan State. But if you wanted to go to Michigan State to take that, the tuition would be over $2,500. So this is a good opportunity to get to participate in the same content for regulators at a much discounted rate. So please consider that. And once again, get signed up now. We will be closing the registration here in a couple weeks. So we will close at the 15th of December. So please consider that. And for your leadership and your staff that are emerging leaders, it'd be a great opportunity also. Moving on, sorry, next topic. Let's move to the next item. Once again, and of course, Deanna is the expert on this particular session, the root cause analysis. There's one more offering of that during this, I'm going to call academic year, February 20th through 23rd. We are full in December, and if I remember right, we have several registrants for the February course already, but there are a few seats left. So if you want to get one of those seats, make sure to get signed up now, because those will probably be gone in the next couple of weeks with the way the registration is going. There's not very many left at this point. So get signed up. Great opportunity. Once again, I won't tell you more about it. You've all heard about it before. Also, basic inspections and investigations for new regulators. Opportunity for new retail and manufactured food inspectors with less than 6 months experience. This is really the basics of being a regulator and some of those key sorts of things that happen the regulator. You can see some of the topics that are included in the course. This is a virtual offering. It is a 20-hour course limited to only 18 people, highly interactive. The December course is full. There are some seats available in May, and we will see, we may actually add one more additional one yet during this calendar year, or during this academic year. Once again, take a look at that. It's something that I think many of you will find very valuable. Process improvement for regulators. Sorry, I'll move into that. And this is a great opportunity, which a cohort experience that includes both a virtual and in-person component. This particular program really focuses on those process improvement techniques. So you really looking at how to develop a better program, having those understandings. Great opportunity for those that are emerging leaders in your program, and that are really helping you to modernize and make your program better. Think of this as really helping to build that culture of continuous improvement within your organization. So just giving you some examples, this course does include a project that continues after the course and for about another 4 months, 5 months. And then at the end of that, all of those projects get presented through the cohort, and then many of them then get featured in other topics going forward. We've seen some really positive results from this. One of the participants last year has now saved over $750,000 in staff time from the project that they did. It was a pretty amazing realization and modernization of something that was happening in an agency at the state level, where they were able to really streamline and utilize those resources much better by a handful of really simple sort of changes that made a whole lot of difference in the amount of time being spent. So just one example, I will tell you, every year there are multiple projects that are just amazing and useful that could really work across multiple programs across this country. So think about this for your emerging leaders, those folks that are really asking some of those questions. Why do we do it this way? Perhaps you're folks that like to break the status quo. This would be a great opportunity. Once again, a very, very small course, very small cohort, but a great learning opportunity to learn from them and their peers. So definitely think about that as a yet another opportunity, and that is an in-person offering, and will be in beautiful Albany in the winter. I know all of us, actually, I'll tell you, you won't have to, everything's very located close by. Don't worry about the winter. Albany is lovely in the winter, as you might imagine, particularly if you don't get to see snow. See, Jessica agrees. I think Angela's on the call. She would tell you Albany is lovely in the winter also.
Laughing heartily, but absolutely.
Albany's lovely any time of the year, but it is a great opportunity. So if you have folks that are interested, make sure to get those applications in early, because that will close once again, because they will begin their virtual learning here on January 30th and the in-person course later. So just go and also start thinking about what a project might be for your participants as you go forward. They're going to be asked to identify that very early in the process, so they can start thinking about working on it as they work their way through the course. Moving on to the last item, I think there's one more. Is that right? Oh, two more. Instructor skills training for those of you that haven't had an opportunity. I will say that this, for those of us that have been through the instructor skills course, I just had someone tell me the other day that may even be on the call, and I believe the words he used were life-changing. I think I just had someone recently, earlier today, tell me it was something they wish they had taken the first day they became a regulator. They're like, this is just so valuable and would have made me so much more powerful in my skills. think of this as not only something for your training officers and program leaders. This is also something for those folks that are really doing a lot of the really good field training work, that are helping to train your new inspectional staff, or those that are really looking for the next level of advancement in the field operation. It is an amazing course. I've been through it. I know many of us on the call have been through it. Make sure to get signed up if you have folks that might be interested, and that this would be a great professional development opportunity for them to learn. Put another skill in their toolbox, or another tool in their toolbox. Once again, just an amazing course. And that one, I'm not seeing the location. Oh, it's going to be, as I call it, Nashville adjacent in Franklin, Tennessee, I believe. So it's coming up here in March. So let's go to the last slide. Yeah, thank you for the advertisements. That is very helpful. Inspector Boot Camp is coming up. Registration just opened for that with both retail and manufactured food programs. Remember, graded opportunity. Oh, sorry. Both basic and advanced just open. Basic is for those that are newer in the career. Advanced is for those that have already attended basic, and includes more advanced skills. Basic tends to be a very similar curriculum from year to year. Advanced tends to be more topical with some differences from year to year. You can see some examples of what's included. There are a couple new items being introduced into both this year, but definitely think about it for your staff and for those others that be interested. And if you have local jurisdictions, feel free to forward that information out to them, along with any of the other trainings of things that you think they might be interested in also. Once again, both of those courses, basic and advanced inspector boot camp, are offered without cost and do come with continuing add hours. So definitely think about those as an opportunity to get some continuing add hours for your staff earlier. Lastly, I just want to throw out environmental sampling is something that we always have available. We do have several requests out. We're going to be announcing some offerings here in the next few weeks, but we've also been hearing from a lot of you that you need, you're looking for a course for your staff separately for your own state. If that is the case, let us know. We can work with you to figure out what that might look like and how we can do that in an efficient manner, and get that out to you all. So definitely take a look at that. Also, email afto@afto.org to request a class, or if we're just looking for a few seats, we have those opportunities too. Just let us know what your need is, and we can help match you to the right spot and the right program. With that, I think we have one last thing. So you all will be getting some communication here coming up. Literally today, it went to print the HACCP plan, the guidance for developing HACCP plans for specialized processes at retail. Literally did go to print today. Sorry, it's taken a little longer than we expected to get there, but it is at the printer this afternoon. And it is a pretty amazing guide. When I've handed it to some of our colleagues that are doing a lot of the HACCP plan work at the state and local level, one of them said, "Why didn't I have this 5 years ago when I started my job?" That's exactly what we're looking for. This was developed by state and local regulators for all of you to have those tools to be extremely effective at the work you're doing. I will note all of our state programs will receive a free copy of that. You may have already actually received a survey asking for where you'd like that shipped to, and who it should be addressed to. Those will be coming out here later in December. So once again, pretty exciting time to get that out. And I know many of you, I'm sure, will find a lot of wonderful pieces to that and resources you've been looking for. Okay, I think that takes me through everything I was going to mention. Deanna, is that correct? Well, Deanna, I'm going to turn it over to you.
Yes, thank you, Steve, for all of those updates. As y'all can tell, we are keeping busy here at APTO. And next, we're going to move on to our feature today, which is a presentation by our partners at NEHA. So Rance Baker is going to kind of lead his team's presentation. They have so much to tell you today, and I think you're going to get a lot out of it. But the Retail Food Program Training Needs Assessment, and Rance, we all know you and think you're great, so I'll just turn it over to you.
Thank you, Deanna. I think you're great as well, and you know that. Thank you, everybody. I think probably a lot of you already know me. I'm Rance Baker. I'm with NEHA, and we're working on a really excited to be able to give you some information on the training needs assessment that we we've finished, but we're in the process of really pulling together all the data that goes with it. Want to thank AFTO for letting me do this presentation. That IST training, I agree with everybody on there. If you guys haven't had a chance to take the instructor skills training, do. I mean, I've been through 3 times now, and every time I go through, I get something new out of it. So it is just one of the best courses there. And I would like to introduce my my team that really has done a lot of the work on this training needs assessment that we developed there. So I'm going to ask Dr. Samantha Striley, do you want to just introduce yourself and let folks know who you are?
Yeah, so I'm Sam Striley. I'm the Senior Research and Evaluation Coordinator at NEHA. So I'm working on research and data analysis on this project, and I'm also coordinating a series of publications that we're putting out about this needs assessment. So keep your eyes peeled for those, hopefully in early 2024.
Thanks. And how about Dr. Gill?
Hi, my name is Gagdeep Gill, and I'm a NEHA consultant, mostly with the evaluation and analysis piece. And this is one of the items we analyzed. Yeah, so stay tuned to this. I hope you guys get something valuable from this presentation.
Yeah. So I am, these 2 folks have just done such an incredible job in there. And, as we're going through, they're really going to be talking about some of the stuff they've been looking at. I can tell you that, they are great people to work with. I have made some of the requests that I think probably other folks that were doing, statistics or research and evaluation would probably look at and go, that guy's nuts, he doesn't even know what he's talking about. These folks are willing to take those questions that I have out there and really go through and look and find things on it. So I just can't say enough about working with this team. This training needs assessment was part of the Retail Flexible Funding Model grant that FDA and NEHA have worked on together there. It was one of the objectives where we wanted to look to see what the training needs were across the country. I think, for many of us, the concept of training needs were we get something from FDA that would say, here are the courses we have available to you. Which of these do you need? And what we really wanted to do was to look and see what the lay of the land out there was, to see what actually were needed in the workforce out there as it relates to the job they do out there. Gagan, you want to move to the next slide?
Yes.
So I'll just real quickly run through the agenda. Right. So today we're really. I'm just going to talk you through the background on what it was that we were that put this all together. There, I will give you some idea on the demographic overview, some of the respondent characteristics. We're going to talk about knowledge areas there, and when we talk about knowledge areas, we're going to be talking about, for the most part, the National Curriculum Standard, the retail food segment of it. And I think many of you are familiar with that. So we'll be calling them KAs as we go down the way there. Just remember that knowledge starts with a K, not an N, so that'll be an easy one to remember there. And we're going to be talking about it at the individual level, the jurisdictional level, and then we're going to be looking at it from the jurisdictional relevance level there, and how can we use the data. And then hopefully we're going to leave a lot of time for questions there, because there's a lot of data that we're going to be going through today. So, Gagan? Right. So the background of the needs assessment, we went back and forth with FDA a number of times on what we should include in the needs assessment itself. And, sometimes we wanted just a really large picture on what the needs were out there, including things like administrative, learning how to use a computer, things like that. But what we focused on was actually the national curriculum standards there. And I think many of you were part of the building the competency. As I saw faces and names on here that I know that I was in meetings with you in 2012, 2013, 2014, 2015, as we pulled together the curriculum for the retail section of the national curriculum standard there. While there was a number of cooperative agreements that were part of the program there, I think most know that IPTI was the one who was really leading the charge on pulling together that framework. And it's now back in works again. Competencies are being built out again across all elements of the human animal foods and national curriculum standard. And I think what this will also help show is that this type of needs assessment, this type of survey might be able to help us determine where we need to focus, rather than as we were going in the beginning, we would start at the bottom and our goal was to move our way up to the top. And I think we're going to be able, we might still want to do that, but I think we're going to be able to see some areas that say we need to pick this one out right here and we really need to start working on it. Thank you. So the needs assessment itself is, the descriptive of it is that we want to reach across the country there. And I think you're going to see that we have a really good segment of the US population that was part of it. It represented across all of the states and territories and tribes that became part of the program there. And it was to look at the retail food workforce. Now we're looking at retail food regulatory workforce there. And we'd have, we want to know who in that program, whether or not you were an inspector, investigator, or you were actually at some sort of admin level and within the agency itself, or maybe in the leadership level. We wanted to know from all of you. We're also looking at it from not just state, local, tribal, territorial, but we also want to look at the federal level and the military level as well there, to make sure that we could see what the retail food regulatory needs were in all those areas there. We broke it down into two areas, and I'll show you a little bit how it works as we go a little bit further in there. But at one level, we want to know at the jurisdictional level there. What is the relevance of the topics within the national curriculum standard for retail food that is important for your agency, your jurisdiction at, if you are something of a training officer or a leader in that organization there. So we wanted to look at you so that you could say, what were the training needs of where I am? And or you could respond as an individual there. And with this area, you're going to see that we not only would ask about the relevance of that topic to what you do in your daily work, but also your exposure to that topic as well. We did not do the exposure level on the jurisdictional level because it would be really hard to determine what the exposure of everybody in your agency was to that certain topic there. Okay. All right. Yeah. I think we're going to move over to Gagan.
Yeah. Thank you, Rance. Yeah. First, we want to talk about the demographics, and really break down to see who kind of responded, right? So the question is, did we get an adequate response to the survey? And as you know, surveys, you don't always get the best response rate, but we did. We received about 2,795 total responses, but we had to, filter it down to those that actually have retail duties, right? So we disqualified about 352 due to non-retail duties, and those that were not primarily in the food industry or academic, right? So those were the 352 comprised of. And then we also disqualified those that left one of the key questions blank, right? And for this analysis, we also didn't include the 14 U.S. territory responses for this call. We can look at that information also, but for this call, we're only looking at United States and states. So our ultimate number is 2,253. And out of the 2,253, we had about 1,510 individual level responses, and then 743 jurisdictional level responses. And I want to add that we achieved a power of greater than 80%. So, to get this response was really, met more than our goal, it should just achieve a statistical power, but not only that, to get both sides, individual and level, jurisdictional level amounts. And you see a map here, and it shows the whole representation in the United States of our response. But we also can only map about, about 705 responses were not able to be mapped. So even if you see, right there, Kansas had 0, it doesn't necessarily mean that no one from Kansas responded. We just didn't have the location, or someone from Kansas didn't share their location information, so we can map them. But this kind of points out, some major states showing some representation. You got Texas, 142, California and Colorado, and then some of this North or Midwest right here. So let's talk about the characteristics. I'm going to leave that to Dr. Striley.
Yeah, so basically this is just going to dive into some of the details of what we actually found demographically so far. So you can go to the next slide. So in terms of gender, first of all, I just want to point out there's a lot of information on this next series of slides. These are a lot of kind of tables to look at. So I have this handy little box highlighting where I'd like to direct your eye. And so really kind of what we want to look at here is the fact that we had more female respondents than male respondents. Less than 1% of the people that responded chose non-binary or other as their gender category, and then 3% chose not to self-identify at all. You can go to the next slide. So in terms of age, what we want to draw your attention to here is that almost a third of the workforce is age 50 or older, and over half is age 40 or older. So we have a little bit of an older workforce here. People who answered on behalf of their entire jurisdiction tended to be a little bit older overall. And that makes sense if you think about it, because they've probably been in the field for longer and are in a position where they can answer on behalf of their entire jurisdiction. You can go to the next slide. So the majority of respondents to our survey identified as white. And we also had about 8% Black respondents and 7% Hispanic respondents. And so these numbers for Black and Hispanic respondents are a little bit lower than what you would expect if the demographics were in line with overall US Census demographics. But we could have collected race and ethnicity data a little bit better. So we did learn a little bit from this kind of survey as well, that we're going to collect it in a little bit better way to make it more comparable to the census data in the future. So we do need to look into this a little bit more, but based on what we have now, the other racial and ethnic categories that people chose here are pretty much in line with national census numbers. And then, so what we're seeing here for professional focus areas is there's a large representation of local and state level food regulatory professionals. So these demographics really represent how retail food is actually done in the field, right? You see more people at those local and state levels doing retail food work. So yeah, this shows that our data is doing a pretty good job of representing the workforce, which is nice. Next slide. So this category was actually a check all that apply. So that's why you're not seeing percentages here, because there were people who chose more than one option for these job functions. But basically, I just want to emphasize that most respondents said that they perform retail inspections or other administrative duties and inspections, which of course makes sense. That's kind of what we were looking for from this survey as well. Next slide. So here we have years worked in the field of retail food safety, and we have a lot of folks that have been working in retail food for quite a long time. So about half have been working in retail food for 10 years or more, and almost a quarter have been in the field for over 20 years. So really what we're seeing here is that we have a workforce that is a little bit older, a little bit getting potentially closer to retirement when we have, the years in the field. We also are seeing a little bit higher number of years worked in retail food safety at the jurisdiction level, which again makes sense because those are the folks that are probably in more of a leadership position that are answering on behalf of their entire jurisdiction. Next slide. And so job level. So we had a really good representation of respondents from all different job levels, from entry to leadership. And you do see a little bit of a difference with the technical specialist category here. It might look a little bit more sparse just because not everyone identifies their position as one at the technical level. So those individuals may have chosen one of the other levels. Next slide. And then we have a pretty educated workforce, with the vast majority holding a bachelor's degree or higher. So yeah, 63.5% of all respondents had a bachelor's degree. And then we have 27.3% with a master's, 2% with a doctorate. So basically just showing everyone has a pretty good amount of education. And then over 84% of people have received some sort of food safety training within the past year. We didn't ask what that training was exactly. We just know that they received some training. So what's good here is that they're staying up to date with their training. And there's really this kind of culture of continued training that I think can probably be leveraged when we're talking about how we can improve training in the future. And I think the next section is, Rance is going to go over this section about the knowledge areas and the relevance and exposure of knowledge areas at the individual level.
Thank you, Dr. Stiley. Yes, so what we're going to be talking about is the knowledge areas that we went through and the results that we got back on it and how we laid it out. So there's there's a madness behind this method that really worked out very well there. So, Dr. Gill. So, for those who are familiar with the knowledge areas within the National Curriculum Standard, these are them. And I think for many of you, it's either you're smiling or you're shuddering right now, considering the amount of time that you might have put into to working on some of these elements there. So what we did was to pick out these areas. Excuse me. One of the key reasons why we chose the National Curriculum Standard to work on was because there was also a survey done in 2012. It was a much smaller survey. It really didn't go into the detail that we did, but it was the validation survey that was sent out. And we're hoping to be able to map over some of the information we've gotten from this one to the survey that IFPTI sent out in 2012 to see if we can see what changes in the workforce were out there. So these are the knowledge areas we asked them about. And next slide, please. We asked them the question twice, and I'm sure some of you were part of the survey response. I mean, because of the size of surveys we got back, and I think I remember talking to several of you who did take the survey. So thank you so much for being part of this. We asked them the question twice. We went through and asked them about the relevance of these topics, each of these topics, to their job. How important is this to my work? And the response level back could be either not at all, it could be slightly relevant, it could be moderately relevant, very relevant, or you're not familiar with that topic. After they had finished going through this survey as at a relevance scale, we took them back through all of these knowledge areas once again and asked them exposure. What kind of exposure have you had to this content there? So either no exposure, some, moderate, strong, or I'm not familiar with this topic. What we were able to do with this the hope was to get away the bias that might show up if we tried to put them both together there, and the bias towards a want rather than the need on there. And by separating the two, what we were able to do is take them apart and put them back together in a very unique way that allows us to see what was going on. And this is the quadrant system that we're working on, that we used by taking them apart and putting them together and asking questions on both relevance and content knowledge exposure there. We were able to get highs and lows and then an intersection on all of those. So if you look at quadrant one there, quadrant one is low knowledge exposure but high relevance. I don't know much about this topic, but it's very important to my job. That absolutely is a low-hanging fruit as far as things that need to be worked on soon. As we go a little bit further through this presentation today, you're going to see a lot of these are often emerging topics that are newer topics there, and it's not necessarily not having the exposure to something that's already developed out there. Quadrant two is high knowledge exposure, high relevance. This says it's important to my job and I know it. So this we would hope would be where the lion's share of the content would lay. But by doing it this way, we're able to see that whether or not that's true or not there. Quadrant three would be high knowledge exposure, low relevance. I know a lot about this, but it's not important to my job. Obviously, this is an area that we would hope not a lot would fall into, and this is areas that would not need to be looked at. Quadrant four then is low knowledge exposure and low relevance. This says, I don't know much about this topic, and it's not important to my job. What we're going to find is quadrant four is unique in its own way, and we'll talk a little bit more about that as we go a little bit further down there. Next slide.
So thanks, Rance. Thanks for demonstrating the quadrant system. And this is really the data that we collected. As you see, as Rance pointed out, the quadrant one, low relevance, and high relevance, low exposure, which is here. And then you see the knowledge areas, a majority of them are here, right? So you can see a good spread throughout the graph here with knowledge areas. But this is encompassing everything. So we noticed this scatter plot and we said, hey, we want to break this down even further, right? It's nice to see everything for everyone, but can we apply this to another aspect, right? Can we look at it at job level, and can we look at that job level and look at the targeted trainings based for the skill scale our workforce based on those knowledge areas we point out. And so you saw the job levels, right? We have the entry level, the journey level, the technical specialist, and the leadership level, right? So these four categories, we broke this information down and shared, or we're about to share that information of how the graphs look like. And as you see, entry level, there's a lot more in quadrant 4, right? So that means that there's low exposure here and low relevance. And then, you could see the pattern here. And then in quadrant 3, as Rand said, there's no really high exposure, low relevance. So most of these knowledge areas are relevant to their work. And if you see, I'm going to go really quick just so you guys can see the effect. It's like a weatherman. And you can see as the level of job level changes, notice the grade in the knowledge areas goes higher, right? And then technical and then leadership, right? So what that means is, as someone goes from entry level to the next stage of journey, technical or leadership, there's more relevant and more exposure to the knowledge areas. But each of these job areas have different but also shared knowledge areas that can be used as part of training. And also another key thing is, if you notice, how it increases is you can see the mean of the relevance and exposure in each of these job levels get increasingly higher, right? From 2.71 to 2.85 to 2.88 to about 3 for relevance. And the same for exposure, looking at their mean values based on that scale.
So
Oh,
what this shows, go back to that last one there. I think we have a well-trained workforce. And I think you guys who are part of the training, who are part of this workforce should we want to acknowledge that with you, is that we weren't sure what we were going to see when we were going through this, but we have a well-trained workforce. And that quadrant 4 area down there, low exposure, low relevance, those topics, if we were to focus in on those topics there, there's low exposure, low relevance, but they're also tangential topics, so it might be lab methodologies or something like that. It's important for them to know something on it, but it's not necessarily important for their job there. So I'm sorry, Dr. Gill.
Yeah. No, thanks for pointing that out, Rance. And we also wanted to share that there's some more further analysis that we can look into. There's so much data out there, and that we collected. One of the other aspects we could take a look at, and I wanted to share, is the level of work experience, right? So we re-stratified the areas of less than a year, 1 to 3 years, as low level experience, 4 to 6 to 7 to 9 as moderate, 10 to 20 or 10 greater than 10 as high. And if you see here, you'll see the similar pattern, right? If you see low, there's a lot more here in some aspects of low exposure and low relevance. But then if you look at the highest group, I mean, as it progresses, you'll see more in this quadrant 2, more level of more skills that they've probably gained, more relevance and exposure that they feel comfortable with. So I just want to point that out. There's so many ways to slice it, but another way we could, or potentially going to work on it, is work experience. And grants, we could talk about jurisdictional level information.
Yeah, so I'm just going to go over these specific questions that we asked at the jurisdiction level. If you can go to the next slide, Dr. Gill. So basically what I mean here is that we asked a specific question in the survey, right? Are you a training planner that's willing to answer questions at the jurisdiction level? So anyone who said yes, we consider those to be jurisdiction level respondents, and that's what I'm talking about in this section. And I just want that to be really clear. So all of the demographic information that we provided earlier about, like, the breakdown of gender and age and all of these other categories, everyone was included in those. These ones are the questions that were specific only to jurisdiction level folks, which I think was 700. I can never remember the exact number, 700 something, right, Dr. Gill?
Yeah,
Okay.
743.
Thank you.
Yeah,
Next
yeah.
slide. So for the number of employees in the jurisdiction, so we got responses from all different size jurisdictions. We have a large representation of jurisdictions with 5 to 24 employees in the jurisdiction. And then this spread of different size jurisdictions really just makes our data reliable because we're seeing representation from all different sizes. So that allows us to say something about the workforce here. You can go to the next slide. And then the number of retail food facilities in the jurisdiction. So again, we have a high representation across the board, as you can see from the bar chart, from small to large jurisdictions who have varying numbers of retail food facilities in their jurisdictions. And we recognize these categories that we grouped the number of facilities into may not give us as much information as we would like to have. So, you know, you could choose between 0 to 100, 101 to 500, and so on and so forth. In the future, we're going to have folks enter a number into a text box because then we can run some more sophisticated analyses on these. And then the percentage of employees involved in retail food safety. So 76 to 100% of employees in over half of the jurisdictions were directly involved in retail food. And that makes sense because that's who the survey was for. Next slide. And then this is a really important point that we got out of these questions. Estimated turnover rate in the next 5 years. So this isn't a definite thing, but it's what jurisdiction level respondents are estimating based on what they know about their current workforce. So here we see almost a third expecting half to 100% turnover within the next 5 years. And so again, I want to bring you back to thinking about years in the field and age in the workforce. So we have a cliff that's coming towards us when older folks potentially retire. And so that's something we need to think about in terms of turnover. And then this last slide that I'm talking about right now is highly credentialed workforce for the most part. This was another check all that apply kind of survey question. So people could choose more than one. So majority are REHS, so they do more than just retail food, but then some folks might also have CPFS on top of REHS. So this is a little bit complex, but I basically just want to draw your attention to the fact that we have, you know, highly credentialed workforce for the most part. Next slide. Okay, so the knowledge areas for the jurisdiction level relevance, I think Rance is going to be talking about this section.
I am. So with that question that Dr. Sams mentioned that you can answer as a training, someone who was responsible for developing the training programs there, we use skip logic to send them to another area there within the survey there. So Gagan. So for those of you who have a good eye for numbers there, I think you'll notice that when we were talking about the individual level there, we had an N of 59 as far as the number of knowledge areas that we were asking them questions on there. At the jurisdictional level, we asked them an N of 74. So there's more topics in there. If you look at K3 and K4 on here, if you can see them, I mean, some of you might be looking on a laptop or so. We have allergens basics and allergens advanced. We asked a number of basics and advanced because those actually are part of the National Curriculum Standard. When we were doing it at the individual level, we really didn't feel that individual would necessarily know whether or not they had advanced knowledge of these topics or just basic knowledge on that. So we pretty much left that out, but we did ask that at this level right here. So that's why the N is different for these. Next slide. So for this one, again, we just asked on the relevance area there. We didn't ask exposure because it was really, we didn't feel it would be possible to determine what a general exposure was for your jurisdiction. So we really just had, we just really looked at it at relevance level there. And again, not at all, slightly, moderately, very relevant, etc. Next slide. So what we're looking at, starting to look at here, and before I go on, I just want to give an idea of what we're planning on doing with this data once we get it all collected there. One is that this is open source, you know, and we're putting it on we're building a platform for it now. The goal is for it to be an evergreen type of process there, but what you're going to see as I go through these next slides is there's a lot of work that's going to need to be done over the next period of time in order to bring folks up to speed with some of the trainings that need to take place there, or to make sure that we keep the ones going that are there. So this one was looking at the relevance. Now, mean for those of you, I mean, mean is just a fancy word for average. So the top highest mean on those 5 there, if you can read them there, it's food code, communication skills, food preparation techniques, food service, and foodborne illness investigation response. I think we would all agree that those are probably like key top relevance areas for everybody there. The bottom, which are saying that they the lowest needs, it seems, and in the relevance area were formula review, imports, resource leveraging, formula review advanced, and resource design there. Next slide, please. So what can we do with this data? And this is the big thing. I mean, so it was wonderful to collect all this data, and we just had a great time working on it. But the goal is to put it to some sort of practical use there. So next slide, please. So one of the things to look at, Sam has brought it up a couple times there, and I just want to keep reiterating. Our demographics show that we have an older workforce that has been in the field for a long time, and I'm talking to me right here at the same time. That have been in the field for a long time and are planning to retire soon. We see this anecdotally. We know that we are tending to retire at a greater level than we're getting new folks on board with that. So one thing that we're going to be able to look at with this training is not only what the training needs are for those entry-level folks, but how we might possibly be able to move them through the ladder at a quicker rate than we might have thought they were moving through before. Remember, we were capturing their years of work as well there. So there's a number of exciting things that we can start working on. So let's look at the low-hanging fruit right first there. Quadrant 1. Low exposure, high relevance. I don't know enough about this, but I know it's very important to my job there. So these are the categories that you see there. Some of them are cross-cutting across all levels. Some of them are just needed more in other areas there. But remember, I was also talking about sometimes these are emerging topics out there rather than things that have been worked on historically in the past there. Food systems and sustainability, continuity of operations, food defense vulnerability assessments, food salvage and disposal, which is a changing field. Prevailing health principles, et cetera. You'll see a number in entry level there, which says we need to get some more entry level training in there. But these are the areas that are the low hanging fruit that we should say we need to either, if the training's available, we need to make sure it gets out there more than it's getting out there now, or this is areas that need development along the way there. So next slide, quadrant 2. So in this one, this is the high exposure, high relevance. Folks, this is our bread and butter. And this is where the lion's share of the folks are there. We could say all is well and good, and all is well and good. Yay, we have a well-trained workforce out there, but this is our bread and butter, and this is the one that needs to be maintained on a regular basis to make sure that we are spending time making sure that the most current scientific knowledge is being used in these courses, that the most current adult learning principles are part of these trainings that are going on, and that we're up to speed with them. We also, because they just have high exposure and high relevance, that doesn't mean they have all the exposure they need to this. So these are the areas where we should probably look at and consider whether an advanced training would be needed in these areas there. So this needs focus. This says, hey, we got something really good right here. So let's look at it and make sure that that we have a system in place for maintaining. For those of you who sit with me on PFP meetings, et cetera, that a lot of my talk is about, let's not just create ones and leave it over in the corner there to collect dust. It has to be looked at and reviewed on a regular basis. And for those of you who took those number of those recent surveys that came out from the PFP training and credentialing work group, thank you so much for doing that, because that's part of what that is doing, is making sure we have current knowledge in these trainings and making sure that the competencies are what they should be for today. Next slide. So talking about targeting the training and upskilling on there, what we're able to do and what we're pulling together is looking at the knowledge gaps between the job levels there, and what type of trainings that we need depending on your job level there, and also how do we upskill you more quickly if needed to that next job level there. So next slide, Gagan. So here are some areas that that currently could use some increased focus by the job category there. And I don't necessarily need to go through and read them all, but if we're looking at the national curriculum standard and we're looking at developing competencies and trainings on things, or if these trainings are already existing out there, we need to get them out there a little bit more, make sure that folks get these trainings that they need. I think some of you looking at them would agree with them. So some of these you might wonder why it's at that level there. That's the data that's coming back on that. So here's the training needs that depending on your demographics of whether you're less than a year, 1 to 3 years, 4 to 6, etc. So this is useful because what we're able to look at and say, here's what the training needs are when we get them in the workforce there. Here's what we need to put in front of them in, after they've been here a while. And here's what we need to put in front of them if we need to get them up to the next level soon. I think many of you have been, gone into a job, a new job there, and just been exposed to a fire hose of information in the very beginning. And usually what you end up at the end of week 1 knowing is how to use a telephone system. And the rest of it, because you don't know the importance of that area right now, it tends to possibly go in or not go in at all and set itself off to the side there. What we're also seeing is that maybe we don't need to expose everybody to the full amount of data that's available out there in the national curriculum standard right at the very beginning there. Maybe we need to phase this in as they start needing it in their workplace there. So what we're seeing here is the possibility that we might be able to stage training so that it's more of a just-in-time type of training for folks, that we can always give them an exposure level training to it, just so they know the topic exists there. But year 1, they're not going to be doing investigations more than likely, and so the idea of, can we put something in front of them when we're ready to get them into those new areas of learning and new areas of speaking in the public, new areas of I'm now starting to do plan reviews, I'm now starting to do HACCP plans, etc. And so, as I was mentioning, we are developing a data platform for this. The goal is for this to be an evergreen type of system there. Our hope is that you're going to be able to go in and zone in on, based on zip code, based on, eventually based on your whatever health department or agency or jurisdiction you're in, and to look to see comparatively wise where you are in relationship to the rest of the country. To do that, we're going to need more data there. And so the hope is that, if you're going in, we use Riverside, California, because that's where one of our folks is from. There on a regular basis. But if you're Riverside, California, and you're saying we don't have any data for us in there, that you're able to get your team to go in and fill out this national curriculum standard, so that we've got your data in there, and we can keep this process evergreen. And rather than making this a one and done or one every 5 years or so, maybe send out reminders on a periodic basis saying, hey, do you need to go in and update your information in there? To make sure that we've got the most current information, because this is where we learn how and where to spend our money as far as training resources. So, and again, there's so much work to be had out there that I think if everybody goes in and just grabs a handful of things there and starts working on them, it'll still keep us busy for many, many, many years. Thank you for listening to me, Dr. Gill and Dr. Stiley. And we're open for any questions you might have. All right.
All right, I am looking, I don't see, I don't see any hands raised. Do we have any questions from our participants today? All right, Kim Stryker.
Hi, this is Kim Stryker from Alaska, and I'm wondering, you talked a lot about we were very well trained, and I think I take that to mean that we have a lot of training that is offered and that is provided. Has there been any analysis in terms of how effective the training is and whether that training is being transferred on the job, and any component of the on-the-job training that takes place, which really represents quite a lot of an environmental health officer and inspector's training program?
So I think, to answer your question, probably the second part there, I think that is taken into consideration there with when they talk about exposure to them, because we didn't ask them, where did you get that exposure to it? It was just more, did you get exposure to it? To your first part of the question, that is the $1 million question there. We would love to be able to take this research that we've done to that next level that says, what is the public health significance of all this stuff that we have, all the training that we're receiving, et cetera. But that was not part of the survey, but it absolutely should be the key driver behind pretty much everything we're doing.
I have one follow-up as well to something that you mentioned. You talked about, what you would anticipate someone would need in terms of knowledge in their first year, what they might or might not be doing. And in my jurisdiction, we have a very small staff. We provide direct services throughout most of the state, with the exception of one local jurisdiction. And our training is rather condensed out of necessity. And people are oftentimes in 1 or 2 person offices. And so they're oftentimes kind of thrown in, and they experience quite a lot that they're asked to do pretty independently. They're seeing a lot of different situations. They don't have a lot of peer support. Do you find that is an exception to the rule, or are other jurisdictions sort of in that same boat where they really have pressure to get people trained quickly and to get them released and on their way quickly?
I would absolutely, I would say it was a second, anecdotally talking to everybody, especially now. COVID caused all sorts of problems with the workforce out there. There are a lot of small jurisdictions across the country there. You bring up a point that, hopefully we'll address as we're pulling together the national curriculum standard that says there's got to be different methods of getting this information to folks, that just in time type of training that folks need to say, great, I do have to do an investigation, and and I just need a refresher on everything that I'm doing. So I'd love, let's make sure that we've got that developed out there. And I'd like to introduce Dr. Randhawa, who is kind of taking lead on this project for us as far as the entire flexible funding model program that we're working on. And he's definitely one of the key architects behind all the work we're doing as well. So Dr. Randhawa.
I'm just gonna add that, those are 2 really good questions. So, keep in mind that when we built this, we built it in a way to can we evaluate that the training you're getting are translating into your knowledge, right? And exposure to that. So it's a Likert scale, right? So we are asking how much training do you have? It's, I think it's 1 to 4, the Likert scale that we used. So I think the last question, Ms. Stryker, that you had about, is there a difference? I wonder if we should look at this from a small jurisdiction, because I think there might be a way for us to do that and say, are we seeing the mean less on those 59 areas in small jurisdiction compared to all of it? That will point to the idea that maybe their trainings are much more quicker and just in time, and they're getting their folks out there and they're not getting the complaint. But please understand that there's a lot of data there. What we want to hear from you all is, how do you think this will be relevant to you? right? So think through this and think about it and email us and let us know that it'd be nice if you sliced and diced it this way. That would be helpful to me as a state or as an organization to say, what do I do with this, right? And I think Rand's talked about this. We absolutely hate doing a survey and a needs assessment that just sits there. We want this to be meaningful, right? We are working on as Rand described, a very comprehensive dashboard where you can start to add your own data, because we want this to be a tool that you can use to compare yourself at the national level, at the state level, and down to the local level and say, where does my staff fit in? And what do I need to do to get myself to the least to the mean of the nation, right? So maybe I'm behind, maybe I'm already in a good place, right? So please think through that and let us know, what do you think would be useful?
Kim, do you see what he just did there? That's the brilliance of working with these guys. That you bring up something and rather than saying, yeah, it can't be done, or I don't know how to do that, there's logic behind doing it. So when Mike mentions, send in your thoughts on things that you might want to see from this data. Trust me, it will get looked at and it will get responded to.
Thank you for that. I do have one follow-up question for you guys. And that is, based on that map that you showed us at the beginning, where the respondents are, is there any correlation to like regionally where different types of training would be needed? And has the data been looked at for like, maybe this could be used as a tool to plan where training should be held if we're looking at doing an in-person style?
So
that's a really good question. Go ahead, Rand.
Yeah, that was a key driver behind putting, that piece of information in there. We did want to see if there was disparities in training across the country. Do the coast get more training than the center of the country, et cetera? But I'll let Mike talk about how it can be broken apart.
Yeah. So one of the analysis we did on the back end is we wanted to say, systematically speaking, of all the 2,200, 300 respondents, how did each person respond? And the pattern we found is that the higher they said that I had this was relevant to my job, the higher the number was my exposure. Hence the idea we were saying that it's a well-trained workforce, right? And then collecting the location, we kind of did that kind of 3 months into it. So we don't have a location for everybody, but we have a location for quite a large number. And we are going to split it up into sections. And I think that's one thing we'll work with FDA. Is it through their FDA's jurisdictions, that the way they have it defined, or is it by state? What is that they're looking for? But our goal is to make this more a tool for you, meaning that you can pick your regions. You can say, I want to look at these 3 states, or I want to look at these 5 counties, or I want to look at only this, and then say, what does it look like there, right? So then that way you can look at it meaningful that way. But we're happy to define this in whichever way you all think it's meaningful and it's doable.
Thank you. Do we have any other questions from our attendees today? Okay, going once, twice. All right, well, with that, I want to thank you all so much, and Dr. Mike for jumping on here. I'm glad you could participate too. I don't want to Dr. Straley, Dr. Straley and Dr. Gill,
Straley.
yes, and Rance, you have assembled a fantastic team, and I am super impressed with what you guys are doing, and thank you for sharing it today. You've truly been enlightening to all of us. I really appreciate this, and we're looking forward to those publications that are coming out. So before we conclude today, I just have a couple other things to remind our attendees from our state retail programs. please reach out if you have any questions, concerns, ideas, potential future topics. We will have a survey coming out in a couple of days to let us know what you thought about this topic and how we did. And don't forget to use the AFDA website. If you are looking for information on any specific topics, we have just hundreds of things there for you to peruse and find what you're looking for. And then last but not least, we have our next call tentatively scheduled for February the 6th. So look for that invite coming out shortly after the Christmas break. And then we're looking forward to our next call in May. So on the evaluations, we are taking all the feedback you give us to find the topics that you're needing. So please let us know what else there is that you want to hear about. And with that, I want to thank you all for your time today. Appreciate you joining us, and thank you for everything you do. You guys have a great day.
Thank you so much.
Yeah, thank you.
Thank you.